This is PukeOlogy Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. PukeNoMo.
So what is considered full-term pregnancy? And why the heck do I have to be pregnant like a whale for months? 10, that is, because they lied to you about pregnancy and say it's only 9. Find out why 40 weeks is so important and 10 natural ways to help to induce full-term pregnancies in this version of Pregnancy Pukeology Podcast, Episode 10. How long is pregnancy? Full-term pregnancy, weeks to months. Do you want no more morning sickness or pregnancy nausea? Or how about getting rid of some headaches or migraines? Visit our sponsor, nomonausea.com, spelled NOMONAUSEA.com, the only natural way to instantly stop your worst nausea, vomiting, and headaches now. Or just place No More Nausea Band on your baby registry for your delivery bag or to make a great baby registry gift. Now available at Bye Bye Baby and Babies R Us real soon. And your little ones are always well taken care of with the first and only anti-nausea remedy for kids that's natural, safe, effective, and mom approved, called No More Nausea Kids, now found at your local CVS store. Pregnancy humor that may just make you want to pee your pants. Like you don't have to pee all the time, pregnant ladies, with crazy hilarious stories like Black Friday turned green, Double Trouble down on my leg, and House of Buckets. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, the 3 things that you can learn are going to be the science behind what's considered full-term pregnancy anyway, what can cause preterm labor, and what are natural ways to induce labor once you are very close and near to your due date.
Throwing up on a Tuesday?
So my first and only year I did true Black Friday shopping, I threw up all over Walmart. It was extremely embarrassing and people kept swarming the aisles thinking that there was some awesome, amazing, crazy special, when in actuality it was my puke all over the floor and I was trying to push people away from coming near and towards me. Let's just say I left Walmart without anything. Thank you, Little Angel and One on the way at Amelia111821 for your hilarious puke story. My first time throwing up, and I have to say I threw up a lot more now, I peed all over myself, and I still do when I tend to throw up. And I'm not ashamed, LOL. I pee my pants every time I throw up, and then I tend to cry now. Didn't quite make it out of the kitchen tonight with me mopping twice, not just the puke, but my streams of tears falling down my face. Mitzvah, MZLIZVH, thank you so much for your hilarious puke story. I still puke several times a day. Several rooms in my house have buckets. I am puking just because I'm sitting. Or maybe I will puke and pee on myself all at the same time. Isn't pregnancy a joy? My youngest, which is 20 months, will pat my leg and continuously ask, "Okay, Mommy? Are you okay, Mommy?" until I'm done and say, "Mommy, it's okay." The other day, my older daughter told my neighbor to come back later as I was, and I quote her, projectile puking all over the bathroom floor. LOL. I died of embarrassment. Thank God she has kids too and completely understands. Do you have a hilarious puke story that you can't wait to share, or something that you remember of how horrible it was when you were pregnant? Send it to me, pukeology@nomonausea.com. Again, that's PUKEOLOGY@nomonausea.com. Or tweet us. Just share Pukeology on Twitter, Facebook, Or you can also find us on YouTube channels so we can all have a really awesome laugh.
The Science of Pukeology.
So everybody wants to know, why is it that pregnancy is actually 10 months and they lie to us and say that it's only 9? Well, technically pregnancy is 40 weeks, but that doesn't mean it's the exact same for absolutely every person. Yeah, so no one really told me about that extra month, and I was begging, screaming, and kicking to get my beautiful daughter out when she was. You have to remember that the eviction notice of 40 weeks is stated because of the fact that usually we use the last menstruation as the start of the cyclical calendar whenever you end up getting pregnant. Pregnancy lasts for about 280 days or approximately 40 weeks. But believe it or not, it can vary as much as about 5 weeks from that determined date of conception, which again, for most of us, since we don't know exactly when our babies were conceived, was calculated by the last menstrual period. That estimation of 280 days after a woman's last menstruation period can actually cause variation in this due date. Did you know that only 4% of women actually deliver on their due date? Holy crap, that means 96% of us are going to either go before or after, which means the due date doesn't mean too much, to be honest with you, at all. So trust your instincts. When you start nesting like crazy, here comes baby. The average length of a normal pregnancy is about 37 weeks. Notice I said average. I personally delivered at 37 for one and 37 and 3 for the other. And by the way, when you see 37 point and whatever those numbers are, that means the number of days. Day 7 ends up completing to the next actual week, since 7 days completes a week. So for me, I was 37 weeks and 3 days. The reason for this variation that we talked about of why people end up delivering sooner or later is because of the fact that embryos can take a little bit longer to implant themselves. This is caused by a late rise in the hormone called progesterone. It has been found that they also take longer to deliver. So if you happen to have one of those babies that took a long time to grab itself on and hold on the inside, again, that hormone has actually been correlated when it's delayed to a later due date. Why? Because they need time to cook, right, ladies? So if they would normally take 40 weeks and they didn't end up implanting until a week later, you have to remember that it's going to want to deliver at 41 weeks to complete that 40-week total gestational time. It has also been found that these babies that we've been talking about deliver about 12 days later on average, which that's approximately almost 2 weeks, guys. So don't be surprised if you hear some women say, oh my gosh, I delivered at 42 weeks. More women that tend to be older, they are considered advanced maternal age. You'll have like this big, huge red sticker on your chart if you're over the age of 35. No, this doesn't mean you're old, but in the cycle, remember, we are born with the same amount of ovaries from the very beginning that we're born all the way through until the end when we end up stop having a period. So all of these eggs themselves start dropping after we end up getting our periods. But women who end up having babies later on in age, so who are over the age of 35 and who are heavier, I don't want to say obese, but let's just say nice and fluffy, usually have naturally longer pregnancies. So that's something that's been interestingly found. Another statistic is white European women versus African American or Caribbean or Asian women usually deliver 1 week after their due date. So again, race has actually played something into it. Now, whether or not that has to do with more or less weight gain, or whether that has to do with the actual implantation early on, could be a deciding factor on whether or not your baby is coming sooner or later. It's estimated that 1 in 20 women would have a pregnancy that lasts longer than 42 weeks. But in the United States and in the UK, labor is induced to prevent potential problems at 40 weeks. Again, when you've been cooking a baby for 10 months, their eviction notice is definitely served. babies can be preterm for a variety of different reasons. So I'm kind of switching the script here. We talked about why babies would actually be due later, but now let's talk about the reasons why babies will actually be born sooner. So a full-term pregnancy is considered 37 weeks or above. Babies that are preterm are considered anything before 36 weeks. So let's take a look at the definition of preterm, because there's multiple different divisions. Extreme preterm infants are 23 to 28 weeks. They have a decreased risk of being able to survive. And that's just because of the fact that they haven't fully developed yet. And even in the incubators, guys, it's still very dangerous, especially to any of the other born pathogens. Hence the reason why most of the time, severely premature infants, you can't even stick your hand in there for fear that you're going to be transmitting some sort of disease, and they just cannot respond normally because they don't have the ability to be able to protect themselves with white blood cells. Moderate preterm, is babies being born between 29 and 33 weeks. Late preterm are infants that are being born between 34 and roughly 37 weeks. Although I said 36 weeks is start of considered full term, most babies that are 36 weeks and above will not spend any time in the NICU. But 37 is that golden standard. If you are like me, I had to go see a perinatologist, and they would not take my beautiful baby girl sooner than 37 weeks. Why? Because they wanted to avoid any risks or complications associated with her going to NICU. Women who have had previous preterm babies are at high risk for other preterm babies. My OBGYN explained it best. You know what she said? She said if you keep a small dog in a small cage, they're going to stay small. So again, my body just must not be able to hold children after 37 weeks. Women with uterine or cervical abnormalities like fibroids or tumors are also at very high risk of having babies that are preterm. And it's because of the fact that the uterus itself is expanding. Remember, if you have something that's obstructing the uterus from growing or expanding on one side, the baby's going to say, hey, I'm getting cramped in here. It's time to get out. You will probably see a neonatologist like we talked about if you are considered at high-risk pregnancy. Same thing is if you're having multiples, like twins or triplets. For sure, you will go early. I rarely hear multiples going at 40 weeks. I mean, that would just be a gargantuous belly in my personal perspective. Every time I'll do epidurals and spinals for these women, most of them, if they get to 36 weeks, we all high five them because that means that they have done their job. They've cooked those babies appropriately. And believe it or not, some of those babies are actually larger than both of my children that were born, one at 5 pounds, the other at 6. Other factors for preterm risks include diabetes, high blood pressure, blood clotting disorders or problems, placental bleeding, also called placenta previa, which if you guys don't know what placenta previa is, anytime that you have red blood coming out of the vagina during pregnancy, more than likely it is considered placenta previa. It's basically when the placenta is kind of like sort of ripping at the bottom and it is nicely thickening, and that thickening causes that bleeding. It is not painful, but you do need to make sure that you talk to your doctor, just because if that area is obstructing where the baby is going to be leaving the body, that's when they would enforce a C-section that is scheduled. Anytime other factors for preterm exists are babies who are underweight. IUGR, which is an older version considered intrauterine growth retardation, is what my child had. So I just make small babies in a small cage. They stay small. Since then, they've given it a better name because, to be honest with you, when my OBGYN ended up telling me that, the only word I heard in IUGR was retardation. So I was very concerned. But he was small. It doesn't mean that he's not huge now and on the 90th percentile for the growth chart. It's just that we still don't really know why he was small, and more than likely it's because he was holding on his cord like Tarzan, not allowing the nutrients to get to him, hence restricting his growth. Another preterm reason is the short time between pregnancies. You need to give your body a break. It's creating humans. It's growing an entire child. So again, that's why they say Irish twins are not always the best. So give your body a little time. Wait that 2 years before you get pregnant again. Also, stress. Smoking, drinking, illegal drugs, which obviously needs to be stated that is actually the number one complication, smoking, drinking, and illegal drugs for babies that are born very small. Even late or no prenatal care is almost like an indicative factor for women end up delivering a lot sooner than what they were supposed to. And if you want to learn about prenatal care, listen to Pregnancy Pukeology Podcast episode 3, Why Take Prenatal Vitamins. We kind of sort of go over why prenatal vitamins are important, what each of the factors in each of these wonderful vitamins and enriched are, and why is it that we need it, especially during pregnancy.
Tips and tricks to stop the up-chuckle that you need.
Ladies, I know what it feels like to be pregnant, and in my last month, all I wanted was that baby out. But remember the March of Dimes, which is the national organization whose mission is to improve the health of babies by preventing birth defects, premature birth, and infant mortality, recommend that inductions be performed only for health reasons of the mother or the baby at 39 weeks. So that is actually the recommended time. If you end up going naturally, and by going naturally, I mean your body naturally starts going into contractions and your water breaks before then, don't worry, it's okay. 36 weeks and above is still considered full term. But they're putting a really big stamp on it stating that OBGYNs, unless there is a health risk for mommy and baby, don't take that baby out until 39 weeks. A baby's brain is the last organ to develop. So the more time he or she has to cook in the womb, the more the thinking part of the brain is actually developed. A baby's brain actually doubles in size during the last few weeks of pregnancy, where at 35 weeks, the baby's brain is only about 2/3 of what it would weigh at 40 weeks. So keep those babies in. I understand how frustrating it can be, but just think how much smarter your child can be, all by giving it day by day by day. And ladies, those who've been put on bed rest, which I was for my first one, even more power to you. Get magazines, stay unstressed, basically ask for help, okay? Because of the fact that you really want them to cognitively grow and grow appropriately. So now that we've kind of talked about all these, the following are different ideas that help to induce labor after you are considered full term. Hence what I'm saying, ladies, no, you can't get the baby out when you're only halfway done. I'm talking about full term, greater than 37 weeks gestational age. And please, talk to your OBGYN, your midwife, or doula prior to trying any of these natural remedies to induce labor. I'm just going to let you know the things that from research has shown that does work once you are full term. And I keep saying that and emphasizing that again. Number 1, exercise. We should all be doing it. Again, during pregnancy, they say don't change your exercise habits. But have people ever told you to walk around the neighborhood a few times will help you induce labor? Well, they're right. Okay, anything that gets your heart rate up, reduces stress because of those wonderful exercise endorphins, is perfect to help see your baby a little bit sooner. Let's talk about sex, baby. So again, sex. Grab your sweetie and tell him super sensually, take me to bed and make me have this baby. Some will buy it, others won't, but sex itself releases oxytocin, which is a medication used in the hospitals to induce uterine contractions to speed up that labor. So having sex is safe as long as your water hasn't broken. Let me say it again. Have sex as long as your water hasn't broken, because of the risk of infection when your water has broken. And no offense to men and women, our vaginas are very dirty, so anything that we are basically putting in there without being a coated baby, once your water breaks, you have no other protection for that baby. Number 3, play with those nipples. All right, so there are men that are of two schools. Either they can't stay off of you during your pregnancy, or they want nothing to do with you. So give them an alternative. Say, play with my titties, right? While you play with your boobs, once again, those are hormones released, such as oxytocin. They also help to reduce, help you increase your contractions. You get these same things when you breastfeed. So breastfeeding isn't just great for nutrients, for giving immunity to the baby, but they help you to shrink down your uterus size because it actually releases oxytocin. It's also been found that women who are breastfeeding have a decreased risk of post-stress or post-traumatic labor, I guess you could say, disorder. And what happens is that oxytocin is that happy hormone. So the more that you can stimulate it by either playing with your own nipples, having your husband play with your nipples, having the baby suck on them once they're actually born, all helps to increase those happy hormones. Number 4, acupuncture can also help to induce labor naturally and release that oxytocin that we keep talking about. Number 5, acupressure points like SP6. The spleen 6 point is on the ankle. It's located about 4 fingers above your inner ankle on the back side of the shin. Maybe one day you will see NoMo baby or, NoMo pregnancy eviction notice as an acupressure ankle band to help to induce labor. Maybe one day. There are also 3 other spots on the feet that can help as well. That's why massage therapists are scared to massage pregnant feet until you are full term. Go on to our nomonaja.com/Pukeology Podcast, and there you will actually find all of these different acupressure points that are detailed and laid out for this exact podcast. Number 6, membrane stripping. Your doctors can use their glove to separate the amniotic sac from the cervix. This releases prostaglandins, which can help your body go into labor itself. Just remember, the larger the doctor's fingers, the better that it will work. So always take a look at their hand size because you really do want that membrane stripping to work so that you go into labor quicker. Number 7, spicy foods, which is an old wives' tales. They have not seen any type of medical studies proving it. But hey, it's worth a shot. Go get some super spicy Thai food and go for it. Let me know. Send me an email, pukeology@nomonaja.com, if it works for you. Number 8, red raspberry leaf tea is said to help tone and strengthen the uterus as you approach your due date. So again, serve yourself a cup of tea, of red raspberry tea, that is. Number 9, borage seed oil, which are actual capsules that can be inserted into the vagina, can also be used to massage the perineum, and the perineum is that point between the vagina and the anus. It's like that flap of skin. This will actually help, and also with massage itself, releasing those oxytocin and prostaglandins. Hey, it's worth a shot when you get super desperate and you need to have this baby. And then number 10, castor oil. I don't like this one, but I will say it. A spoonful goes a long way. This and licorice have been known to induce a laxative effect. You will poop all over. But, which in turn, when you have this basically movement, uncontrolled movement of having diarrhea, it can in turn lead your uterus into contracting, causing you to have that baby a little sooner than you had anticipated. These are 10 great remedies to help you meet your gorgeous new addition definitely very soon. Now you guys know the science behind what is considered a full-term baby and why 40 weeks is so important. So thank you guys again for joining me. Ultimately, Pregnancy Pukeology Podcast is here to give you the answers for the best information about pregnancy that there is to date. If you love Pregnancy Pukeology Podcast, let me know. Give me a 5-star rating. Give me hearts for likes, or even better, share this prego story by writing a review. Let me know how I've helped and or affected your pregnancy, hopefully for the better, and then share it on social media with everybody else to let them know how hilarious puke can be. Don't forget to download this episode, but more importantly, share with all of your preggo friends. Thank you so much for listening to Pregnancy Pukeology Podcast, Episode 10. Now you know how long pregnancy is and full-term natural ways to induce labor.
Pukeology Podcast, edutainment at its finest.